Hey, welcome. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center. And this show is for you, by you, and about you. It's all about good health, how to get healthy, how to stay healthy, how to be healthy, how to eat healthy. And, you know, I'm not a guru, I'm not an expert. I just know from years of practicing nursing that what we do ourselves, we have to be the go-getters in our healthcare. We need doctors to go and give a problem and say, please help me with this, or I've got a pain here, or I've got diabetes, or whatever the ailment is. That's what I'm for. I need to know those things. But then I believe that you are the driver of your healthcare bus. I'm the co-pilot. And so if you say, we're going straight, we're not going to the right or to the left, then that's what we're going to do, whether I think maybe we should go to the right or not. That's what I tell my patients because, you know, they've lived on this earth a long time and they know how to take care of themselves. I give them recommendations. Some of them like them, some of them don't. And we just, you know, I give what I consider good advice and good suggestions, and then they go from there. So this is a community service program sponsored by WHIG-TV. The owners of the station are very interested in our community. They're very interested in all aspects of our community, from good health to politics and everything in between. And so they sponsor this show for you so you can learn some stuff. So we're going to talk about a few things. I was looking for something that I had printed off, and I don't know if I've got it or not. Look right. I don't think I do. For some reason, I got almost everything, but not everything. Anyway, all right. So today is National Women's Day, and so we are to celebrate women. So I salute all of my fellow nurses out there. I salute all of the women that are in any kind of health care out there. I salute all my entrepreneurial friends. I have a lot of them who are women-based owned businesses. You've met some of them. My friend Michelle does Restore with Essential Oils. My friend Jean does Optavia and health coaching. My friend Sally does embroidery. I've got another friend, Maria, who does that as well. And I know a lot of women entrepreneurs and women business owners. So I salute all of them tonight. And I thought it might be fun to kind of talk about some of the pioneers of nursing people that I have looked up to, I've learned about, I've studied in my years of nursing, and these people are taught in nursing schools still today, I guess. I don't know. I haven't been to a nursing class in a while, but I'm assuming that they have. And so first we're going to talk about Florence Nightingale. She is really the founder of nursing, so to speak. She is the one who really started nursing and having it help people, having it be clean, noticing needs in communities that nursing would help, and she is a pioneer. She was a pioneer in her role in nursing. She was born in 1820 and she died in 1910. She's a true national heroine. And so, this is something I didn't know already. I've learned something. Florence Nightingale was born in Florence, Italy in 1820 to a wealthy English family. From a young age, she harbored ambitions to become a nurse. She cared for the sick on her family's estates and believed her godly calling in life was to reduce human suffering. Florence's family, however, were not supportive of her ambitions. At the time, nurses did not receive proper training, and nursing was not considered a suitable occupation for a woman of Florence's status. Her mother eventually changed her mind between 1850 and 1851, and Florence Nightingale received basic nursing training in Germany. She was only allowed to attend for short stretches of time, however, and she had to keep her education a secret. By 1853, Florence freed herself from her restrictive family, and during her connections took an unpaid position working in a nursing home for a gentlewoman. And then what were the years of the Crimean War, about 1850 something, she became interested in taking care of these fallen soldiers and these soldiers that had so many medical issues from the war, being shot, being bayoneted, stabbed. And so here it is. In October of 1853, the Crimean War began, and that was fought between the Russian Empire on one side and the alliance of the British, French, and Turkish Ottoman on the other. Newspapers regularly reported poor conditions and lack of medical care for the soldiers. In 1854, at the request of the English government, Florence went to Crimea. She led a group of nurses to a place called Sakutari, and that was the site of a British hospital, which is now in Istanbul. Her party was not welcomed by officers, however, and she quickly realized how horrible and bad the conditions were, from insufficient supplies to dirty, overcrowded rooms. She eventually even called the barrack hospital the kingdom of hell. Under Florence's watch, wards were properly cleaned and standards of care were established. This included attending to dressings, feeding and bathing soldiers on a regular basis. She also recognized the need for psychological care and became known as the Lady with the Lamp, checking on patients at night. And you know, even today, nurses, when they receive their pins for completing nursing school, they get a little mini lamp, and it's a reproduction of the lamp that Florence supposedly carried, checking on her patients in the night. Florence's work was widely reported at the time and in the press, and she shared soldiers' letters, and the letters shared her accomplishments and her hard work. And she quickly gained fame and was credited for reducing the mortality rate in the barracks hospital to 2%. Later it was learned that the death rate was actually much higher than this, but numbers had been doctored by the government. Imagine that. I've never heard of such. By the time Florence returned home in 1856, she was seriously ill. She was also an icon. The Victorians had a vibrant celebrity culture and active print media, which was fanned by industrial advances in publishing and the invention of photography. Florence's persona was particularly popular, with her often being represented as a ministering angel, mirroring common social impressions of women as selfless guardians and caretakers. Such was Florence's celebrity status that her signature is included in an autograph album belonging to Helen Leach, Beatrix Potter's mother, along the likes of the Duke of Wellington, Robert Peel, and even King George IV. Let's see, I don't want to go into all of that. I want to go into more of what she did. Florence really didn't like the spotlight, and she was reluctant to be in it. She used her influence to campaign and push for better health care in England and to encourage public respect for nursing. Her efforts were high profile, and she even met with Queen Victoria and Prince Albert to champion the needs for reform. The Nightingale Fund was set up in 1855, and to open the Nightingale School of Nursing at St. Thomas's Hospital in London in 1860. St. Thomas's is still an important hospital in the NHS landscape of today, and Nightingale's nursing school taught skills that went on to form the basis of modern nursing today as we know it. In 1859, she published a book, Notes on Nursing, What It Is and What It Is Not. And that work is still, that work of nursing brought care principles into households across the country. Nursing is an art, and if it is to be an art, it requires exclusive devotion, and as hard a preparation as any painter or sculptor's work. And I can tell you, taking that RN boards was one of the hardest tests I've ever had in my entire life. It was harder than my nurse practitioner board was. And you know, nursing is still one of the most respected professions in our country. I think most people appreciate what nurses do. I don't know. I think they rock. I admit I'm a bit biased. Florence Nightingale had a special relationship with the National Trust, and her sister married an English politician and a soldier, and she visited them regularly and was given rooms to work on her nursing books and to hold important meetings. And she spent a lot of time during the summer with her sister and brother-in-law, and her rooms have been preserved, include a number of objects that belong to her. Many of her possessions remain with that family, including an orange she was given by a soldier in the Crimea and a lock of her hair. Now, how you kept an orange after all these years, I don't know. So Florence's legacy still shines like her lamp. 4 hospitals in why can't I talk this evening? I'm either yawning or I'm tongue-tied. In Istanbul are named after her. Various daycare facilities in Derby pay tribute to her, and the new emergency hospitals that have opened in response to the 2020 coronavirus pandemic have been named the NHS Nightingale. So she really also influenced the status of the Red Cross, which can be seen on the armbands, ribbons, aprons, medal, and letters found everywhere. With the ongoing reverence of her nursing care now especially poignant, Florence Nightingale is not to be forgotten. So she is the founder of nursing, and she really did establish better care, cleaner, washing your hands, applying clean, non-bloody dressings to a wound, things like that that were not done previously. And she was really a pioneer in that and pushed for that. And I'm sure she had a lot of pushback too, as anybody that is in a pioneer role, you know, gets a lot of that. So I think we're going to take our first break. It's a little bit early, but then we're going to go on to Clara Barton, who is another famous nurse. And she's the one who discovered and established the Red Cross that we're still using today. So nursing has really played a very influential role in you know, taking care of people, keeping them safe, keeping them healthy, reducing the death rate of particular problems, whether it was the Black Plague or coronavirus. And those nursing principles still go on today. And I am so proud to be a nurse and so proud to be talking about these ladies today on National Women's Day. So we're going to take our break and we'll be right back, so don't go away. Then we're going to talk about Clara Barton. Hang on.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Hi, I'm Richard Koss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Hi, I looked on my phone. I had printed off some information for National Women's Day, and I wanted to read that, and that's what I forgot or left. I probably left it on the printer at work. But anyway, so National Women's Day is always celebrated on March 8th. It started in 1857 when female textile workers marched in protest of unfair working conditions and unequal rights for women. It was one of the first organized strikes by working women, during which they called for a shorter workday and decent wages. So it's always celebrated on the 8th. That's when it started, and that was on March 8th in, what do I say, 1857. So how come I've never paid attention to it before? I don't know. I'm just not with it, I guess, anyway. So, you know, I just wanted to talk about women. And I meant to tell you that this is March 8th, and it's I'm live tonight. It's 7:21. So if you have any questions or have any comments, give me a call at 252-407-1111. So I'm just looking to see if there's any other thing. And you know, it's kind of sad that this started in the 1850s, and there's still disparity between wages for men and women. Men and women doing the exact same jobs, men are going to be paid more than women are. Men are paid more in my office than I am for doing the same job. Is it fair? Heck no. Am I going to raise a ruckus? No, it's just not worth it. I got to pick and choose my battles, and that's not one that I'm probably going to win, and I might lose my job, and I'm just going to go, and I'm grateful for my job, and I'm grateful of the people I get to take care of. So that's just not a fight that I want to fight. but it still goes on today, and it's really sad, isn't it, that we've been celebrating this for 150 years or more, and well, more, about 170 years, and we ain't there yet. I don't know what it's going to take, but anyway, enough of that. So I wanted to highlight Clara Barton as well, who is really known as the founder of the Red Cross. I don't know if she really founded it, but she was instrumental in really highlighting it. So she was born in Massachusetts in 1821, and she was the youngest of 5 children. And Barton supplemented her early education with practical experience, working as a clerk and a bookkeeper for her oldest brother. She worked for several years as a teacher, even starting her own school in Bordentown, New Jersey. And that's about where my husband was raised. I've been to Bordentown, New Jersey, in 1853. In 1854, she moved south to Washington, D.C., in search of a warmer climate. And I don't know that Washington, D.C. is much warmer than New Jersey, but anyway. And from 1854 to 1857, she was employed as a clerk in the patent office until her anti-slavery opinions made her a little bit too controversial. Then she went back home to New England, and she continued the charity works and philanthropy that she had started in Washington, D.C. Early in 1861, Barton then returned to Washington, D.C. when the Civil War broke out. She was one of the first volunteers to appear at the Washington Infirmary to care for wounded soldiers. After her father's death in 1861, Barton left city hospitals to go among the soldiers in the field. Her presence and the supplies she brought with her in 3 Army wagons were particularly welcome at the Battle of Antietam or Sharpsburg, where overworked surgeons were trying to make bandages out of corn husks. Barton organized able-bodied men to perform first aid, carry water, and prepare food for the wounded. Throughout the war, Barton and her supply wagons traveled with the Union Army, giving aid to Union casualties and Confederate prisoners. Some of the supplies, like the transportation, were provided by the Army quartermaster in Washington, D.C., but most were purchased with donations solicited by Barton by her own funds. But after the war, she was reimbursed for her expenses, so that was kind of cool. In 1863, Clara Barton would travel to the Union-controlled coastal regions around Charleston, South Carolina. On July 1863, she moved from Hilton Head to Morris Island to tend to the growing number of sick and wounded soldiers, a list that would greatly expand after the failed Union assault on Fort Wagner in 1863. Later, in the Morris Island campaign, Clara Barton, working out of her tent, would seek to address the growing problems of sickness on the island by passing out fresh food and mail to the troops in the trenches. But despite her great efforts, she became gravely ill and had to be evacuated to Hilton Head Island. It's all kind of right down the road, isn't it? In 1865, Barton returned to the North, where her brother and nephew had died. In March, President Abraham Lincoln appointed her to the great general correspondent for the Friends of Paroled Prisoners. Her job was to respond anxious inquiries from friends and relatives of missing soldiers by locating them among the prison rolls, parole rolls, or casualty lists at the camps of Annapolis, Maryland. To assist this enormous task, Barton established the Bureau of Records of Missing Men of the Armies of the United States and published rolls of missing men to be posted across the country. It was at her insistence that the anonymous graves at Andersonville Prison were identified and marked. In 1869, she traveled to Geneva, Switzerland as a member of the International Red Cross. In 1880, the American Red Cross was established. the accumulation of a decade of work by Barton. She served as the organization's first president until 1904 and continued her tradition of philanthropy as a volunteer in Cuba during the Spanish-American War. She died in 1912 at the age of 91. So those are just a couple of my heroes. There's many, 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 many more stories of women fighting in wars and alongside of men and helping. That these are just two that I highlighted because I knew that they were both nurses. So I just I don't know, I just love nursing, and I'm passionate about nursing, and I'm passionate about helping others, and I'm passionate about bringing good information, just like Clara and Florence. They brought good information, and they helped to educate people and to bring people more aware of things that were happening. So to provide some different kinds of dressings for wounds other than corn husks. You know, I think that there's just so much that was done then, and there's just so much that can be still done today. We all need to work together. We all need to be a community. It's not just about women. It's not just about men. But it is a day of celebration for women. So my hat's off to all of you women out there, even if you are a stay-at-home mom, which is, to me, the hardest job that you have. I was a stay-at-home mom for 14 years, and it was the toughest job I had. But I do remember when I went into nursing, got my degree, and then started working at Nash. It was really nice to be Linda. I wasn't Bob's wife. I wasn't Louie, Sarah, or Philip's mom. I was Linda. I was me. I was my own person. And you kind of lose some of that identity when you're busy, you know, changing diapers and cooking suppers and running to PTA meetings. So, you know, there's a season for it all. There's a time for us all. That was my time to be home with my children. I don't regret it. I sometimes think that's why I'm still working, though. I'm trying to make up those 14 years of when I didn't have a paycheck and get a little bit more retirement in the bank, that kind of thing. But really the reason I work is because I like what I do. I love my patients. I love my job. For the most part, I have days I didn't have a good afternoon. I was frustrated. Stuff happens. It's the nature of the beast. I'm sure there's not anybody that has a perfect day every day at work. But all in all, I love what I do. I enjoy what I do. I like this program. I like to be able to bring you good, pertinent information. So that's my spiel on women. So we've got a little bit left. It's also Colon Cancer Awareness Month. So we're going to jump from nursing to how to protect yourself from colon cancer. You know, it is such an easily identifiable cancer. And when it's caught early, it's about a 99% cure rate. So why are we so afraid of doing a colonoscopy? Why do we put it off? What are we afraid of? The procedure itself is nothing. It's a piece of cake. That's the best sleep you're ever going to have in your life, I can tell you that. The prep is a little bit more difficult, and that's not a whole lot of fun. But isn't it worth having it done? It's a simple 15-minute procedure, and you know, it can save your life. It can have mommies and daddies for children and husband and wives saved, and it's just it boggles my mind at the statistics of the amount of colon cancer that is unrecognized and is not dealt with. Now, there is a new test out called Cologuard. You have probably seen it advertised on TV. It's got some stupid little dancing box with feet. But I guess I pay enough attention to it to know that, to me, it's a stupid little dancing box. So I guess maybe that's the whole point of the advertising, is that I'll pay attention one way or the other, whether I think it's dumb or not. But this month is colorectal cancer. It's the third most common type of cancer worldwide. 2 million cases were diagnosed in 2020. It is the second most common cause of cancer death, leading to almost 1 million deaths per year. This is despite the fact that effective screening techniques exist that could reduce the number of deaths in the disease. So let me get back, I kind of jump all over and I go down rabbit trails, but let me go back to the Cologuard, which is non-invasive. That you get this little kit, it's mailed to you, it gives you explicit directions on how to collect your stool sample, and then you put it back all in the box and you mail it off to the company. And it tests for cancer DNA. It's very effective. It does have some false positive results, as just about every test does, I guess. One thing it will show, if you have polyps in your colon, then it's going to show positive. And a lot of times when you get those polyps soon enough, you get them before they turn into cancer. So, there's nothing you have to do but have a daily bowel movement to have this test, and to take a few minutes of your time to read the instructions, do the test properly, and send it off to the company. So, and it's all free. I think it's all free. I think it's all free, or your insurance pays for it. So there's no reason not to do it. The guidelines now say that we should start testing for colon cancer at age 45, and some GI docs still won't do a colonoscopy till age 50. So that 5-year in between, the Cologuard is a perfect way to start people thinking about colon cancer and having the testing and doing prevention. So I'm a big pusher of Cologuard, because especially for the younger population, when they cannot get a colonoscopy, and they probably don't want it anyway. So colorectal cancer awareness is observed in March. Here I go. I'm either tongue-tied or I'm yawning. And it's to highlight the importance of screening for colon cancer, as well as to promote healthy lifestyle habits that can decrease a person's risk of developing cancer of the colon, rectum, or anus. The 3 distinct cancer types referred to collectively as colorectal cancer. The burden of colorectal cancer is highest in Asia, where more than half of all the cases and deaths are recorded. China alone accounts for more than 500,000 new cases a year and more than 280,000 deaths per year. Japan records the highest number of deaths in colorectal cancer at almost 60,000 per year. The International Agency for Research on Cancer estimates that the global burden of colorectal cancer will increase by 56% between 2020 and 2040. That's over half, to more than 3 million new cases a year. The estimated increase in death in the number of deaths from the factors can increase or decrease a person's risk of developing colorectal cancer. Most of these factors also affect the risk of developing other cancer types, similarly increasing or decreasing them. For example, alcohol consumption was responsible for more than 160,000 new cases of colorectal cancer in 2020, or 8% of all cases of the disease diagnosed that year. Alcohol consumption can increase a person's risk of developing at least 6 other cancer types, including liver and breast cancer. Now, that's not to say you can't have a glass of wine with dinner and you can't have a mixed drink when it's your birthday. It's not talking about a alcoholic drink that you have once in a while. But if you're drinking 2 to 4 to 6 drinks a night, that's who we're talking about. Other known risk factors from alcohol includes Other known cancer risk factors include tobacco smoking, which causes lung cancer, and human papillomavirus, that's called the HPV infection, which causes cervical cancer. Both of these risk factors also contribute to the burden of colorectal cancer. Another factor that increases the risk of developing colorectal cancer is obesity. Now you're starting to step on my toes a little bit. Obesity was responsible for more than 85,000 cases of colon cancer and 25 cases of rectal cancer in 2012, or about 23% of all colorectal cancers diagnosed that year. Obesity increases a person's risk of developing at least 7 other cancers. Intentional weight loss, physical activity, diets rich in fruits, vegetables, and fish can decrease a person's risk of developing colorectal cancer when it is at an earlier and potentially more manageable and treatable stage. So we want to check it out early. We want to, it's just what I keep saying, eat good, healthy food, fresh food, food God made. If it's got words in it that you can't pronounce, don't eat it. If it's in a box or wrapped in cellophane, don't eat it. There's no nutritional value. There's a lot of chemicals, and we don't need chemicals to increase our cancer risk either. So let me see what else I've got on colorectal cancer here. There's a bunch of videos with this one thing. So, all right. We're going to take our next break. And then when we come back, we'll talk about survival rates for colorectal cancer. So if you have your test and you get colon cancer, then what do you do? So we'll be right back after this break, and we'll talk more about that. Hang on.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
All right, welcome back. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center. And tonight we've been talking about National Women's Day, and I highlighted two of my favorite nurses. There's plenty of women out there that need to be highlighted, but I just chose two nurses that are fairly common to most folks. They've heard of Florence Nightingale and they've heard of Clara Barton. So I highlighted them. And then we started talking about colon cancer because March is colorectal cancer month. So I guess they're sort of related, nursing to colon cancer. Yes, right? So survival rates can give you an idea of what percentage of people with the same type and stage of cancer are still alive and have a certain amount of time, usually 5 years. That's kind of the marker, the highlight there, 5 years and you're considered cancer-free after they were diagnosed. They can't tell you how long you will live, but they may give you a better understanding of how likely it is that your treatment will be successful, and we all want that. Excuse me. Keep in mind that survival rates are estimates and often based on previous outcomes of large numbers of people who've had the specific cancer, but they can't predict what will happen in any particular person's case. These statistics can be confusing and may lead you to have more questions. So be sure you ask your doctor who is familiar with your situation and what numbers may apply to you. So what is the 5-year survival rate? A relative survival rate compares people with the same type and stage of cancer to people in the overall population. For example, if the 5-year relative survival rate for a specific stage of colon or rectal cancer is 80%, it means that people who have that cancer are on the average about 80% as likely as people who don't have that cancer to live 5 years after the diagnosis. So where do the numbers come from? The American Cancer Society relies on information from surveillance, epidemiology, and end results databases maintained by the National Cancer Institute to provide survival statistics for different types of cancer. The SEER database tracks 5-year relative survival rates for colon and rectal cancer in the United States based on how far the cancer has spread. The SEER database, however, does not group cancers by the stages, which are 1, 2, 3, 4, and 5. Instead, it groups cancers into localized, regional, and different stages. Localized means there is no sign that cancer has spread outside of the colon or rectum. So if you got to have cancer, that's the one you want, localized cancer. Regional means the cancer has spread outside the colon or rectum to nearby structures, other organs, or lymph nodes. Distant, that means the cancer has spread to parts of the body such as the liver, lungs, or distant lymph nodes. So in the 5-year relative survival rate, if it's localized, it's 91%. Hence the reason for early testing. How much better to get your test and not have anything and say, woohoo, and then you can go out and have that one drink. Or how much better is it that you went and got that Cologuard test at age 45 and they found something and it was localized, and that gives you a 91% survival rate. And that's pretty daggone high, I think. And if I'd want a survival rate, that would be the one I'd want. Excuse me. Regional is 72%, distant is 13%. I'm not going to go through some of these here. So the numbers that apply only to the stage of cancer when it's first diagnosed. They do not apply later on if the cancer grows, spreads, or comes back after treatment. So like stage 1. These numbers don't take everything into account. Survival rates are grouped based on how far the cancer has spread, but your age, overall health, and whether the cancer started on the left or right side of your colon changes things. If cancer cells have certain genes or protein changes, how well the cancer responds to treatment, and other factors also affect your outlook. People diagnosed with colon or rectal cancer have a better outlook than some of these numbers show. Treatments improve overall time, and these numbers are based on people who were diagnosed and treated at least 5 years earlier. So there's been a lot of progress and a lot more good news in the last 5 years. So, you know, you can read all this and know all the numbers, but ultimately it's just, we need to go ahead and get the testing, and if we've got it, we got to face that head on and deal with what we got to deal with. So there's stages for colorectal cancer, and so we're going to talk about those. So there's stage 1, stage 2, stage 3, stage 4, and stage 5. So patients diagnosed with stage 0 and stage 1 colon cancer are often cured by the surgery that removes the cancerous polyps or tumor. And that's why if you do the Cologuard and it says it's positive, and then you go and get your colonoscopy and there was no cancer, but there was a polyp, those polyps can very easily turn into a cancerous polyp. And so you go, you get that positive test, you get that colonoscopy, you get those polyp or polyps removed, and your survival rate is way up over the top. And surgery is often the recommended treatment for stage 0 colon cancer. That's a polypectomy, is snaring and removing the polyps that contain cancer during a colonoscopy. You can have an open abdominal surgery that removes cancer part of the colon and lymph nodes in high-risk situations. You know, everything tries to be done minimally and the most non-invasive, but if you've got something going on, you have to have your belly cut open, we got to do it. And for stage 1 colon cancer, surgery is often the recommended treatment as well. And it can either be a colectomy, which is a removal of all or part of your colon through one incision. It can be done laparoscopically, which means your surgeon makes a few incisions in your abdomen and they pass a tiny camera and tools to access your colon, and then that portion of your colon is removed. They do a lot of laparoscopic surgery. My gallbladder was removed laparoscopically. You have a lot of knee surgeries, repairing torn meniscus, that is done laparoscopically. So, you know, that is becoming more and more used. It's, you know, less and less invasive. It's much easier to have those 4 or 5 little small incisions where the cameras go in than to have one big long one that opens up your belly. So for stage 1 rectal cancer, and which is a little bit different than colon cancer, there's a variety of different surgeries used to treat that. There's the low anterior resection for tumors that are high enough in the rectum to permit reconnecting the colon or rectum to the anus. And that's a procedure called anastomosis, and you can have an anastomosis in other surgeries as well. Then there's the abdominal perineal resection with a permanent colostomy when the distance between the tumor and the anus is too short to allow a safe anastomosis. And you've all heard of or know of people that have what we call a colostomy bag. They do not process their elimination through their anus anymore. It's all eliminated it's routed towards the side, and then you place a bag on top of that. That bag collects the refuse, the excrement, the waste, and then the bag is thrown away. If the tumor has gone through the outer layer of the rectum, or there are cancer cells in the lymph nodes, then you're going to have chemotherapy or chemo and radiation, depending upon how severe, how many, that kind of things. And that's where your oncologist comes in, and he'll make that determination of how much chemo, how much radiation, and what kind of chemo is done. So chemotherapy is treatment for stage 2 colon cancer, and that's a little controversial. While surgery to remove the tumor in the colon is universally accepted as an initial treatment, the value of chemotherapy after that surgery to keep cancer from reoccurring is hard for both the patients and the doctors to judge. It's estimated that between 4 and 5% of patients with colon cancer will benefit from chemotherapy. However, there are side effects, some severe, associated with chemotherapy. There are often clinical trials available for stage 2 colon cancer for patients. I'm not sure if there's any of those going on at the Cancer Center at Nash. They do have a lot of trials going on. I'm not sure which ones they've got going on at this time. So for patients that are medically fit and able to undergo combined methods of therapy, this treatment can be chemo radiation before surgery, abdominal surgery, chemotherapy afterwards. It really all depends upon how far, how many lymph nodes, how far up, all those kind of things that we talked about. Now most stage 3, we've gone from 0 to 1 to 2, now we're in stage 3, and they will receive a recommendation of surgery, colostomy, chemotherapy, and possibly radiation. Then it goes into the different kinds of chemotherapy they have. I'm not going to go through that. I don't understand half of it, and I'm sure you don't either, and we'll just move on. Just know that it's chemotherapy. And so for rectal cancer, abdominal surgery is often required to remove all the tumors. And you may have treatment with radiation and chemo before as well as after surgery. Let's see. And stage 4 is metastatic or recurrent. And it requires a consultation with medical, surgical, and radiological doctors. And so it's getting to be a little bit more difficult now, and a little bit more convoluted, and a little bit more needing more folks with expertise in there. So if the liver, lungs, or lining of the abdomen are affected, you may undergo multiple surgeries to remove metastatic disease. Often chemotherapy and radiation are combined with surgery to shrink the tumors. So there's different surgeries, and there's different chemotherapy treatments. There's also some other drugs that are available if your tumor is not responding to the chemotherapy that they've given you. And it goes into the different names of that, and you've heard of some of them. They're on TV, but I'm not going to go into any of that at all. I just want to really focus on how important it is to start treatment at 45. Start screening at 45. You can do the Cologuard. I'm sure all of the doctors that my audience goes to have that availability and can get their patients to that particular test. Non-invasive and free. You just take your time to get the box together and send it off. So we've talked about National Women's Day, we've talked about super nurses, we've talked about some colon cancer, why it's important for you to have the different modalities and why we need to be preventative as much as possible. And once again, the best prevention, well, one of my favorite sayings is an ounce of prevention is worth a pound of cure. So let's start by eating right, let's start by exercising, don't smoke, drink alcohol in moderation, the same old thing I say week after week after week. All right, my time is up. I'll see you next week with more of Here's to Your Good Health. Good night.